My name is Clive D'Souza, and I serve as chair for the IEA, the International Ergonomics Association Technical Committee on Informal Work. You're joining us here as part of our Informal Work webinar series. We, as a technical committee, hold one webinar about every month or every other month, focusing on aspects of ergonomics and informal work in different parts of the world. Today's webinar is focused on informal work that occurs in the United States, focusing specifically on New York City. A little bit more about our technical committee. We are all about increasing awareness about the occupational health and ergonomics issues facing informal workers. One of our presenters today, Akran Salman Navarro, will be speaking more about informal work, the context for this type of work, and some case examples of informal work that occur in New York City. I've provided on the slide a link to our website. Our technical committee meets third Friday of every month at 8:30 a.m. US time. For those of you interested in joining us or learning more about what we do as a technical committee, you're welcome to send me an email and I can add you to our invite list. Our next meeting is scheduled for Friday, October 17th. It usually runs for about an hour to 90 minutes, where we discuss different projects, different new opportunities, different webinar topics, and plans for the upcoming year, including conference planning. I've listed here also some of the key members of our team. These include our Vice Chair for Latin America, Arlen Garagay, the Vice Chair for Asia Pacific, Professor Mohammad Muzamil, Vice Chair for Africa, Augustin Aqua, and Vice Chair for Europe, Maggie Graf. If you are in any of these regions, you're welcome to contact the Vice Chair, or you may contact me directly, and we'd be happy to include you on our email list. On our website, you'll also find a link to our previous webinars, which are all available on YouTube. On that note, please remember that today's webinar is also being recorded, and a recording of this will be made available on YouTube in the next couple of weeks. So moving on to today's webinar, today we'll be focusing on informal work in New York City, and we have two presenters lined up. First, we have Professor Akran Salman Navarro, who's affiliated with the New York University Grossman School of Medicine. I'll keep my introductions very short, and I will hand it to Akran next because he will provide a more exhaustive introduction and also be translating in Spanish. So Akran will be speaking about an introduction to informal work in New York City. After Akran, we will have Nilbia Coyote, who is the executive director of a community-based organization in New York City, New Immigrant Community Empowerment, abbreviated as NICE. And Nilbia will be talking about some of her work in the community and how it intersects with ergonomics and occupational health. So with that, I'm going to pass it on to Akran, who will provide an introduction and set the context for today's webinar. Thank you again for joining us, and please post your questions in the Q&A feature so we can discuss them at the end. You may post in English or Spanish because both our presenters, unlike me, are bilingual and very fluent in English and Spanish. Thank you for joining us again. Akran, over to you.
Thank you, Clive. Thank you to the IEA, Andrew, and the whole staff in the background for inviting us. Thank you, Nilbia, for being here. Great collaborator for many, many years, and we'll talk about our collaboration a little further in the webinar. Well, my name is Akran Salman Navarro. I'm an occupational physician and ergonomist in training. I work at the NYU Grossman School of Medicine locally. It's my day job, but yeah, we have many collaborations internationally with the Global Coalition of Informal Work, which is newly formed, as well as the Technical Committee of Informal Work at the IEA under the leadership of Clive, who has done a marvelous job through this year. And within ICO, leading a few agendas along with other colleagues on decent work, informal work, healthcare, occupational health for healthcare workers, among others. So I will share my screen right now, and the focus for today. I mean, we've been having a few webinars through the year on different types of informality, a lot of the concepts, And we, we wanted to bring a little bit of what we do here in New York City. I mean, the webinar's name is Informal Work in the US, but that's a little bit overstated. Because as you know, there's 50 states, and sometimes cities like New York City are a whole world within itself. So it's a focus in New York City and the New York City area, and what we've been doing for many years now. So I declare no conflict of interest, of course. And I wanted to bring a little bit of the background, historic background. When we talk about work, we can talk about stages. And informality has been embedded in all these stages as we see it through a history. We had, pre-historic area, we had human labor was specifically forced by hand labor. And informality was the norm. Nobody had a, quote unquote, what we call a formal job nowadays. And then stages would go, I'm not going to read all this, but stages have been going on, after we've been evolving, the Bronze Age, the Iron Age, and all of this. And then, mechanization and water steam power came in the third stage. And then, we started getting some sort of formality. But at the end of the day, there was also informal work within these stages. And then we fast forward to the future. Right now, we're seeing the sixth stage, where we talk about, sensor robotic manufacturing, for example. Right now, we're seeing less human labor, and we see more robotic labor. But then, but ultimately, humans are also needed, and informality, as we know, is also embedded. And in the future, we'll talk about this a little bit later, with the new AI anticipating human needs and people entrepreneuring with different types of self-driven work, you can talk about informality as well. Now, work is, I always like to put this couple of slides, because we need to understand the context, of what we mean about informality and what do we mean about work per se. And I know when, with all the collaborations with the community-based organizations, they can definitely relate to this, and which we're going to talk about later. I mean, work is a social determinant. When we talk about health, you can see that, health is always described in different theories as, education as a social determinant, healthcare as a social determinant, neighborhood, social community context, economic stability. All of these are the actual social determinants that are being described in the literature. But you can see that none of them mention work. But technically, work is embedded in all of them. In fact, some of them are driven by work or vice versa. Economic stability includes work. Built environments includes work. Social and community context includes work. Educational access and quality also includes work. Healthcare access and quality also includes work. So, it's significantly related, determined by where you live, the quality of education, and the healthcare linked to your job. Unfortunately, in some of our societies. Now, we can use work as a social determinant, and or work as a fundamental cause of some occupational disease. We can also use work as an intervention. We can modify work to make an intervention per se, right? So we can say, hey, I will use work to intervene and improve the working environment of migrant workers, informal workers, formal workers per se. And we can also use work as a conceptual bridge. I mean, what, is it a cause, or is it the actual cause, or do we use work as an intervention? And now we're speaking more into post-retirement, quote unquote. I mean, people are retired, but they keep working. Or maybe informal workers or migrant workers, they get to an age where they're in the 60s, their 70s, they don't have the luxury to retire. So this whole retirement conversation is now front and center, which has become a whole social determinant within itself. Now I've been working on vulnerability my whole life, and then and you can talk about different types of vulnerabilities and workers that are really vulnerable, but we're going to focus a little bit on informal and migrants. Okay? Now, the workforce has been changing and will keep changing in the future. We have aging workers, we have more migrants for whatever reasons. forced migration, voluntary migration, but it is a reality. We have more informality, more women in the workforce, veterans, we have more wars and more conflicts, then we have more veterans. Multi-generational, more staff turnover, less unionization, unfortunately. We're seeing in the world. More people with chronic diseases as the workforce ages, we see people with more chronic diseases, which we have to deal with in the workforce. Now, how are we changing? How does this work? How does this change the way we work? Well, we know there's new ways of working now. We have more teleworking, more contractors and more temporary workers, more small businesses, declining social protection, unfortunately, depending where you live. We have pandemics, war, climate change, you name it, But we'll focus more on informality in this presentation. So before we dive into the New York City arena, it's important to understand, the global context. I mean, 61% of all the jobs are worldwide are informal. Let this sink in for a minute. That means that in the whole world, 6 out of 10 people work informally. In some countries like India and some countries in Central America, it goes up to 90%. That means that in some countries, only 1 out of 10 people have an actual job, as we know it, as we call it. So it is, we in this technical committee and this topic and in the global coalition, which I'll speak about later, I mean, this is not a problem. We don't see it as a problem. We see it as a reality that we need to manage, This is something that we're not, so we ask ourselves the questions, what is the solution? Formalize 60% of the population, or actually provide them with the dignity and services that they need as if they had a quote unquote formal job. So this is the conversation that we are having. That's the whole point of this whole technical committee that we're in and other initiatives we have around the world. So we're talking about 2 billion people, and 93% of them concentrate in developing countries. But interestingly enough, in cities like New York City or in cities like Berlin in Germany and in big cities in the first world, we see informality all over around us, everywhere around us. It's part of our lives. We see informal work as part of the workforce of a city that drives the city, drives the economy. Now, there is I'll talk about it later, there's a cross section between informality and migration, and I'll speak about it on the next slide. But informality sometimes, it's sometimes, no, it's a lot of time, it's generational. There's a lot of people that work informally around the world that have generationally work informal, culturally driven, for example, make food, they make, I don't know, make hats, they make, I don't know, you go to the mountains in Ecuador and they make garments, and, they've been doing it informally their whole life. So it's something that, a lot of times we have to see it more as an asset, as something to respect culturally. And then when you come to big cities like New York, I mean, with everything so intended to be controlled because of health reasons, because of social reasons, then that's where we have initiatives, so everybody is on the same page and contribute, homogeneously. It's also present in high income countries, like I mentioned before. So this is just a slide just to see a little bit about around the world before we dive into New York City. I mean, we see informal work in Honduras, for example, up in the 70%, and there's a mix also in different. This is a Latin America snapshot. Now there's a cross section, like I said, between migration and informal work. So if we take 2 billion people that work informally in the world as a denominator, around 150 million migrant workers as the numerator, that means that 6% of informal workers worldwide are approximately informal. In other words, that out of the 100% of informal workers, around 6% of them are migrants, right? But if you flip that coin around, out of the 150 million migrant workers, probably 65% work in informality. In other words, the majority end up working in informality. So it's something that we need to look at, and sometimes it's deeply intertwined and mixed. And the second part of it brings us more into the local, big cities in the developed countries, because in developing countries like India and Honduras, for example, 90% of the population works informally, but not all of them are migrant. In fact, most of them are not migrants. They're Hondurans or they're Indians, So, but then when you go to the big cities like New York City and others, then if that coin flips around. So it's important to understand this phenomenon. Now, there's reasons why people migrate, and this is the International Organization of Migration. We've been working on this for many years, and then they describe this very nicely, that there's four phases of migration. You got the pre-migration phase. People start deciding, should I migrate or not? Should I migrate voluntarily? Am I being forcibly to migrate for whatever reason? And then people decide to migrate, And then you get the movement phase. We've seen this many times in history. You have people that walk for months to get to one place to the other. Or they can just catch a plane and then land in John F. Kennedy here airport, and then fine, they're here. But that movement phase has his needs and his journey itself. Then you got the arrival phase and integration phase. People arrive and try to integrate into a society, which sometimes is welcoming, sometimes is not. And then, and that's where, a lot of the things we do here are bringing all these services to migrant workers who a lot of them go into the informality, so they can have, dignifying and at least well-deserved lives, and bring food to the table and provide for their families and the society. And yes, there's a returning phase. A lot of people decide to return for whatever reason. Geopolitically, when things change in a country where you migrated to, people decide to leave. I don't want to be here anymore because of the current president or the current administration or the current whatever's happening. There's a war, so people try return or re-migrate or migrate again to different parts of the world. So we can hypothesize that all these phases are work-related, because the main reason why people migrate is to pursue a better life, right? And a lot of people migrate with work in mind, or with already a working position in their planning, in their life planning. But for those who don't and migrate for whatever reason, because they were forced to migrate, or they migrate to for example, to study, or for family reasons, they also need to work, because you have to work to provide for yourself. So that's where the whole conversation comes on migrant workers, informality, and so forth. So you can say that migration is also a social determinant within itself. Individual factors, lifestyle factors, living conditions, working conditions, social community, a little bit of what we spoke in the first couple of slides. So migration it can be a social determinant within itself, keeping in mind that most people migrate to work. Now, as a clinical scenario, us as a clinic and me as an occupational physician, when we see a patient who is a migrant or informal worker, we see a patient who deserves as dignity and as good of a service as any other patient that walks into our health system. So, but there are some determinants that we need to be aware. Language, skill communications, for example. I mean, we're lucky that we work on which I'm going to talk about later, on a health system here in New York City Health and Hospitals, where you can call a number and you can have over 100 languages being simultaneously translated in front of you. In fact, there are languages that even are indigenous dialects that we also have access to. So these are some of the services that we provide. So, you have the income and poverty, accommodation, sanitation, nutrition, and so forth, legal status. A lot of people are unfortunately part of human trafficking, the ability to work, health literacy, isolation. I mean, you name it, So we have a patient in front of us who comes in with an occupational injury, let's say a broken shoulder or whatever, or they come in for just, a health surveillance, but they work informally, or they're migrant workers, and they have their own social determinants that we take advantage, that we take into account. In fact, we've had patients that come into our clinic system, and they're informal or migrant workers, for example, and they come in for a broken shoulder because they were, I don't know, they were working in construction, and they're in their 50s, and this visit, it's their first time they've been to a doctor in their entire lives, like including back in their country. So, something to, of course, it's important. They don't even know if they're diabetic, they're hypertension, they don't even know, so these are a lot of the services that we provide. This is a slide that was given to I borrowed from Dr. Fandinho Lozada from the Universidad del Cali. He very nicely laid out that there's an informal, you can talk about informal work, but they're embedded on an informal sector. So you have the informal sector and formal sector. Now you have informal workers that can actually be part of a formal sector. So this is very interesting because, for example, if you have a demolition company in New York City who works on demolition, right? They're a formal company, they're a formal provider, and they have formal workers, but they might have in their workforce workers who are informally contracted. So they're part of a workforce. They're a workforce that is part of a formal sector, and it gets a little bit more complicated because you're part of a formal sector, but you don't have the benefits or the protection that a formal worker should have, and thus you don't have it. Now, when we talk about precarity, that means instability at work. Then you might and we see that a lot in big cities. Sometimes you have an employer today, sometimes you have an employer tomorrow, sometimes you have another employer next week. So that precarity also deepens the issue on informality, but they're still part of the workforce. I mean, when you see somebody, one next to the other, I mean, and they're doing a great job and they're contributing to society. I mean, I mean, you're doing your job. I mean, who cares? If you're informal or informal, or more informal. But that quote unquote, who cares? It's the piece, the way they're being seen, but internally, it does. We do care. We do care because it becomes difficult for them to have the benefits and the protection that they should need as workers. We've been speaking about 4D jobs for many years. 4D jobs. We've been publishing this in many areas. We're still developing. That comes from the 3D concept that we've been reading for many years. It comes from the Japanese expression kitanai, kikei, and kitsui. Which is dirty, dangerous, and demanding, or dangerous and demanding. And we've been adding to the literature the 4D, which is the discriminatory part of it. In other words, the 3D job concept has been focused more on the physical exposure, but then that social determinant part of it's left out on the 3D concept. So we've added a 4D. We've proposed to add a 4D into the literature where that discriminatory aspect of it, wakes up policymakers and pushes for new policies in order to, hey, if these workers are going to do this dirty job, you also have to understand that it's not only the physical part, it's also the mental, psychosocial, social, and socially determinant that makes them, sick or ill within the workplaces. So it's not only if they push, they pull, they carry, or they're exposed to chemicals. It's also that societal issue, which is unfortunately by design in some societies, or some of them are not by design, but they are discriminatory. So, and we're in the technical committee of IEA, which is, focused on ergonomics and human factors. And a lot of what we do, a lot of what these workers do are biomechanically exposures to biomechanics. But it goes beyond the biomechanics. I mean, we can say, we can talk about garment workers, carpenter, bricklayers, sewing. I'm not going to read all this. Construction, agriculture. They can be formal or informal workers, but within the informality, it goes beyond the biomechanical exposure, because you have these workers that have to worry about all these biomechanical exposures, thus the potential of musculoskeletal issues, musculoskeletal diseases and injuries. But in addition to that, all the social determinants that we've mentioned before on the presentation, and the discriminatory aspect of it, and many things that are happening around the world and locally as well. So they have an additional burden. They have an additional reason for what they should be worried on, and that reason has to be taken into account for us, amongst us clinicians and experts in occupational health and ergonomics, and also community-based organizations who help and protect these workers with their programs. Just some numbers. Here in the, they say that in New York City, 52% of all New York City business are owned by migrants, and they contribute by 22% of the city's GDP. So it's not a trivial contribution. But at the same time, I always like to put these slides about the reciprocity and how much migrant and informal workers and all these workforce contribute to their local societies, but they also contribute to their people back home. I mean, these are numbers about how much remittances around the world have been sent to the people they leave behind. We're talking about around $1 trillion in money being sent back to their home countries after people migrate and work in informality, or not so much in informality, but also as migrant workers. And specifically with regards to informality, the contributions on agricultural are immense. Domestic workers, construction, transportation, mining, you name it. And these are ILO numbers, which are of course very well disseminated around the world. Now, informality doesn't always mean a 4D job, dirty, dangerous, demanding, and discriminatory. Now, with the new forms of work, we can think about, how the generations have evolved, right? Now, I mean, my kids and your daughter, Nilvia, for example, when they go into the workforce, they probably won't want to work 8 to 5. They're probably going to be entrepreneur, and create something and build an app, or it's a more, the newer generations are more inspiring, co-creating, more virtual, more, so how are we? This is not a utopic future, Now, how are we going to address this as occupational health experts, or people who focus on the health and dignity of workers? If somebody's working at their home, making a lot of money, and don't are not part of the social security system, are not part of the health system, and if, for example, they get sick, how are we going to do preventive work or preventive interventions for them occupationally? So, and some numbers show that by 2027 we're going to have millions of freelancers. In fact, millennials and Gen Z, half of them prefer freelancing than actually having an actual job. So how is this shaping modern workforce? We're going to address this situation. So I guess the point of these two slides is to understand that informality doesn't always translate into some precarious, dirty, dangerous job, but also the instability and somehow discriminatory also, that you're not embedded. So we were talking about 60-80% of the working population around the world being informal in some areas. And now with this shaping of workforce, it's only probably going to grow. So it's something for us to think about and have it on the conversation. Going more in depth into the New York City, we're talking about, street vendors are informal workers, lacking social and effective legal protection in their employment. Well, there are not really very strict statistics on the city total of informal vending workforce. Some advocates say that close to 10 to 20,000 New Yorkers make living, selling food in the streets, for example, and they're part of our culture. You get on the 7 train and you get off in many of the stations in Queens, and it's part of daily life. And you can see here a picture in the 1900s, in the 19th century, and then you see the picture next to it, which is this month, and then you can see the same situation. And this is not going to go away. This is part of our culture. So how we as health experts, as policy makers, as community advocates, grassroots organizations work towards the dignity and health and safety of these workers. And well, not everything is bad news. There's a lot of good news going on. We live in a city where, fortunately, for now at least, we're technically a safe haven health and hospital system for all New Yorkers. And New York has a health and hospital system. It's it's the largest health system in the United States, about 1.4 million patients a year. Close to 500,000 of them are uninsured for whatever reason. Some people are uninsured, some people are underinsured, but we still, provide seek care without fear, and provide interpreted language for more than 190 languages. And then it's a large system. And we're, of course, a small clinic that's within Bellevue Hospital. But we've been doing this for over 30 years, and we go a long way along with the public health system of New York City, which is something that it's something to really understand and in some ways replicate in different parts of the world if possible. So it's also we work at Bellevue. It's the oldest hospital in the United States. And then we've developed this community university collaborative approach where we have sanctuary services, New York City's public policies. We focus on non-discrimination policies regardless of the income, migration status, and all of that. So when you come into our hospital system, you see stuff like, we care about, your health, not your migration status, seek care without fear. Our own business card on the back, I'll read it for a few seconds. Our mission is to provide the highest quality clinical and preventive occupational environmental medicine service to those New Yorkers who are at high risk of work-related diseases and most in need for these services, regardless of the ability to pay. Of course, it's not a free service, but there are some mechanisms, where people get their care. And there's always a way to find, to give the best care possible while protecting the health system itself to function correctly. And then going more in depth of what we do with the community-based organizations, we've developed this collaboration between us and the CBOs. I'll be calling them CBOs from now on. Where we have a very close relationship with the population that each CBO protects or organizes. We also work with a lot of unions, organized workers. And there are some proactive employers, believe it or not, that are very responsible and take advantage of some programs that actually the state provides them, where if they're proactively improving their workplaces, they can get some benefits in their workers' compensation premiums and so forth. Code Rule 59, Code Rule 60. They're in place. So there are a lot of programs where we work together with all these organizations that help a lot of these vulnerable workers that are typically left outside of the health system, and we bring them in as a health system per se. And there's a trust building. I mean, a lot of these workers who are afraid of, working informally or being migrant workers, or whatever, they're uninsured or underinsured, they gain this trust from the CBOs, which is incredibly important. And these are a lot of the organizations that we work with. I mean, later on, I'm going to hand it to Nilvia Coyote, who's the director of NICE. She's going to speak a little bit more about it, more in depth. But these organizations organize different populations within New York City. For example, ADICAR is an organization that organizes Nepalese workers, and a lot of them work in nail salon, for example. Laundry Worker Center, they're also working in laundries, another, as well as Make the Road New York, Workers Justice, and RWDSU as a union who is very active and collaborate with us. And this trust factor, and we saw it during COVID. I mean, we had to come and explain to people basic stuff like, I mean, does the vaccine caused me to get COVID. It's like, so we had to explain to them in basic language, along with community-based organizations, and on how this worked. This is just an example of what we did, back then, and we still do right now. And keep in mind that a lot of this information was in the public health system. You go into the city website, the state website, and the federal website, and WHO, whatever, and you see all this information. But these workers would go to the community-based organizations and ask them, because there's a trust factor that was very, very important. And then, of course, us working with the CBOs, we will give them the evidence-based background, in order to deliver this information the best possible. And we've been doing a lot of community interventions, ergonomics, and other, with different industries, formally and informally, of course, regardless of where they work, regardless of their migration status, regardless of their ability to pay. So we've been working in car washes, hospitality, nail salons, constructions, demolitions, and depending on construction is a very large word, but within New York City, at least, when you talk about construction, which is so much of it going on in the city, you have demolition, carpenter, cement, bridge, you name it, so there's a lot of course, a lot of vulnerable workforce there who are part of that fourth D that I spoke earlier, unfortunately. And and these are just a list. I'm not going to read them. We can share these slides. During COVID, we did outreach. We were all sheltering in place. We were at home, and then but even if we were home, we paired with the CBOs to reach out to many New Yorkers, and then we did tons of webinars when this was not the norm. Before we used to see each other's faces all the time, but after COVID, the world changed when it comes to communication, work, and as we know it. And we reached out to many of these community organizations, which NICE is one of them. And we reached out with thousands and thousands of workers, especially for those essential workers who didn't have a choice during COVID. They had to go to work. They had to go on so for you and me to stay at home and have internet, eat, have electricity, there was hundreds of thousands of workers behind the scene who didn't have a choice. They needed to go out and work. And these are usually, most of them were essential workers who were, yes, formally, but a lot of them were informal workers. A lot of them were migrant workers who just didn't have a choice. They didn't have a choice because it was part of their job, or they didn't have a choice because they needed to bring food to the table. They couldn't afford to stay home for a month. What are they going to eat? And then back then, we learned very well that although there was a hyper focus on health workers at the beginning, rightly so, because we had 800 people dying every day in New York City. So of course, the health workers were like front and center. But then we also learned the lesson that on a next pandemic or a next mass fatality event, we shouldn't hyper focus on any specific workforce, because then the curve started moving up and down. Then you say, okay, so we protected health workers so well that we've had people working on COVID ICU who never contracted COVID, for example. That's how well we protected them. But then we had the delivery worker, or we had the guy sweeping the street next door, or we had I don't know, so many workers that unfortunately are not with us right now because we just weren't ready. So these are the things that we unfortunately had to learn, and hopefully will not happen again. So yes, so what do we do specifically to work for when we're here at the International Ergonomic Association? I like always to put this slide. When we talk about ergonomics, everybody thinks immediately that here's the guy who's going to change my chair, right? So I call it the chairologist. Well, we actually do more than that. So as occupational health experts and ergonomists, we see everything more on a macro or micro ergonomics level. We go from cognitive design to actual manual labor, to see how tools are designed, and everything it's embedded in industry. It can be formal, it can be informal. You can have intrinsic vulnerability, you can have extrinsic vulnerability, but ergonomists usually see the whole system approach of design for us. Bottom line is that when we talk about informality and we talk about vulnerable workers, we try to focus on low-cost solutions. Because if I go to a group of informal garbage pickers and I tell them, hey, you need to use exoskeleton robotic system, of course they're not going to do it. So there are a lot of interventions who are low cost, who can minimize the risk factor the most possible. And we do prevention through design. This is a prevention through design framework that was proposed by our beloved, now defunded NIOSH, for now, where you try to do an inverted pyramid. The best way to do it is eliminating, hazard removing, all the risk factors, especially on informality and vulnerability. You can substitute the hazard. You can do engineering controls, administrative controls, so you can provide PPEs. So this really reflects on how are we doing prevention to provide the best services to workers. Yes, the easiest thing is to provide personal protective equipment to everybody. You just go in and just give it to them. But are we really eliminating the root cause of the problem? Are we really improving the workplace permanently or creating culture? So these are things that we always like to lay out in our presentations and on our interventions. That is something to think about. Sometimes it's a mixture of things. Sometimes we can do substitution and PPEs. Sometimes we can just not eliminate. If you're working on under the sun, laying out asphalt in the street, and it's 100, it's like 40 Fahrenheit, 40 degrees. I'm gonna speak in Celsius, because most of the world it's Celsius. So if you're like 39 Celsius and with 100% humidity, that's something you can't change. So how do you eliminate that? So that we control it in different ways. And we're here at our clinic. We've created a lot of programs where we can provide this ergonomic service and occupational health services. Clinically, creating reports for occupational physicians. We do workplace assessments and interventions. We simulate. We do remotely. What do we simulate? We simulate because a lot of the times we can't go into workplaces. We're not allowed to go into workplaces, or they're just inaccessible. So we simulate. We've implemented a lot of train-the-trainer programs with community-based organizations where we train trainers from CBOs, and at the same time, these trainers train thousands of workers in the city. So it's some of the programs that we've been implementing. And also, of course, the participatory aspect of it. It's very important that workers representatives, and workers advocacy groups are part of the programs, and that's part of what we do. This slides, I like to place it again, once again, just to remind that it's a community, university, collaborative approach and health system. Okay. This is something that an organization that I like to also acknowledge. This is the National Day Labor Organization. They organize day laborers. What is a day laborer? We call it jornaleros. You're maybe working, you're standing in a corner, and then they contract you for the day. That's why they call day laborers. You come with me. You do one day you do this, the next day you do that, and then you never have a permanent job, or so it's informality at its root, but they're still working, they're still contributing to society, and they're very needed as well. So they also organize them. There are some initiatives in the city, like for example for the canners, where there's around 8,000 to 10,000 canners. So there's campaigns on show canners love and the environmental contribution that they give to the city, which is very important. And they give them the resources for them to exchange what they collect for money. So these are things, they're all over the city. Of course, these programs need improvement and they always need funding, but just by having the initiative of showing canners love, it goes a long way. It speaks volume. And there are also, everybody that goes into a subway system, we always enjoy the music and all the great performers. And the city has this whole initiative under New York where they give them the platform for them to also to perform with dignity, basically. And just to finish, we've been publishing a lot of the framework of decent work, because at the end, this is what we want. We want a future for decent work, and we've published a couple of papers under the leadership of Paul Schulte within ICO and other colleagues that I highly suggest you read. One was staging the framework, then furthering decent work and expanding occupational health and safety. And finally, we've recently created a global coalition on informal work, which I've had the honor to preside as the first committee, leadership committee, along with Clive De Sosa, who's part of the board, and Claudina Nogueira and Maggie Graf, who's also part of the leadership, newly formed global coalition, and others who are in this call that I'm sure are aware of. So you'll also be getting a communication to be a part of this initiative, and remind you also that we're going to have our first international conference on informal work in Cali, Colombia next year. So it'll be interesting for you to just write down this date, save the date, and if you can attend as a speaker or as an organization or just as an attendee, we greatly appreciate it, and thank you very much.
Thank you, Akran, for this amazing presentation. I guess it's my turn.
Yeah, no worries.
Thank you so much. I would like to give a very short overview of what we see from the CBO aspect of the informal work, and obviously provide a little bit more of what we do from my organization, which is New Immigrant Community Empowerment, where we work with, I guess, a very vulnerable population, which is the work that they do, the way they survive in your city is mostly through informal work. So thanks, Akran, because he's sharing our website. And I'm just
Thank you, Nivia. Thank you. Go ahead.
Thank you. So just to give like a very short background, examples of informal work in your city, Akran already gave like a very general picture, and I appreciate that. Just to give you more examples, you mentioned street vending, right? And this is sorry, I'm just gonna go back a little bit more of some points that I wrote this morning. Of course, in New York City, as in any other cities in the world, informal work refers to jobs that are not covered by labor laws. You guys are the experts. I don't need to tell you this. But this is some of the elements that we provide to our own community members when we do our labor workshops, right, on their own rights. Jobs that are not covered by labor laws, they don't provide social protections or tax requirements. They are often involved in self-employment or wage working on regulated environments, such as street vendings, as we know, day labor, and domestic services. These workers frequently lack benefits like health insurance, pensions, paid time off, and can be vulnerable to exploitations through the arrangement can, though the arrangement can provide a necessary income source, especially for immigrants or low-wage earners. These workers frequently lack benefits like health insurance, pensions, paid time off, and we already say this, they can be vulnerable to exploitation, etc. Some examples in New York City, Akran already mentioned the street vendings. We already saw pictures selling goods from carts on the streets without the proper permits or regulatory oversights like many food vendors. But that could be also selling clothing or selling toys, selling many candies, sending fruit. We see everything in New York City, and I assume that in all our cities we see everything. And this is not necessarily the fault of the workers. As we know, this is also the lack of the permits and the lack of the policies, like the case of New York City. We also see day laborers, workers, often immigrants. This is the case of the population that we have for many years cater and nice, who gather at curbside markets to find temporary work for construction, landscaping, or other tasks, what we often call gigs. Domestic work, services such as nannying or cleaning, performed without formal contracts or protections. We also see informal work in restaurant factories, farm laborers. Workers in this industry hire informally by larger formal businesses without benefits or adherence to labor laws. We already mentioned lack of protection, regulated environments, precarious work, tax and regulatory evasion, and obviously all the other elements that we mentioned, the on books versus off books, and it obviously men working in construction, working in landscaping, working other type of jobs, but we recognize that the most vulnerable population, at least in what we see in the city, is generally women, who tend to work in homes, personal service jobs, light manufacturing, traditionally low-paying jobs, while men held the majority of the jobs in transportation, construction, and other relatively higher-paying blue-collar jobs. So now going back to NICE, and thank you, Akran, for sharing our website. I would like to talk a little bit more about who we are as an organization and our history, and why we have been working so close to advocates like Akran. And I'm just gonna mention our mission, and after that, let me see what you're sharing right now, Akran. Oh, do you mind going to our history? Yes. And before going to our history, I'm just gonna mention our mission right now, because it has been changing over the years. And I want to mention that right now we want to create an organization that nurtures and strengthens the spirit of every immigrant who comes to this country. Our objective is for each immigrant to reach their maximum potential by developing skills for life and work, thus fostering the resilience and confidence necessary throughout their journey and prospering in their personal and professional life. And I want to start with that because, as Akran mentioned, the life of anybody is entirely important as a whole, not based on the value of their labor. And I mention this because for many years, and this is without criticizing the work that has been done in our organization, for many, many years, I know that we have focused in protecting immigrants based on what we have achieved through our labor. And we believe at NICE that we need to advocate for our members as a whole, as everything, as everything that they as they contribute. So do you mind going hasta arriba de la página? Thank you. I don't know if it's obviously as you can see, right. Just to give you a little more of background, I'm sorry, and I didn't remind you this. My name is Nilvia Coyote. I have been the executive director of NICE for almost 4 years. I've been at the organization for almost 6 years. I met Akran at the beginning of the pandemic when I started working at NICE as the director of training and education in a very important, obviously, period of the organization. And back then we had just turned 20 years, and now we're obviously celebrating our 25 years of empowerment. And NICE was created in 1999 to 2000 when the New York was going through difficult moments of a lot of anti-immigrant rhetoric. Obviously, when the attacks against World Trade Center happened, that rhetoric exploded, and some neighbors of the area of Jackson Heights, Queens, for the people who know New York City, it's an immigrant enclave, and it was a very tough moment for that area. And that's when advocates for immigrants decided to create a movement to really protect and defend diverse immigrant communities in that area of Jackson Heights, Elmhurst, Midwood, in the area of Queens. Very diverse, not only for Latino communities, but a very, very diverse multicultural population. And that's when that's how NICE was created. Not only for the Latino community, which is actually like the current population that we serve, but back then, 25 years ago, it was more like the vision of the original people who created our organization. However, I don't know. Can you go back to the website? Se te fue. um, However, with the years, obviously, the people who led the organization, very incredible leaders, decided to focus on more vulnerable population, and that's when working in the area of Jackson Heights, Queens, they started noticing that multiple men were gathering on the streets, and they were waiting for jobs. They were waiting for daily gigs. Then we're talking about the day laborers who were waiting on the streets, waiting on the corners, waiting to be picked up by other men, generally, to be taken to construction sites to do some jobs, to do some cleaning jobs or painting jobs, or basically the basics, the foundation of constructions, in non-unionized jobs, very vulnerable, very dangerous, precarious jobs, low wage jobs. And some of these people didn't have the training. Obviously, they were like being very vulnerable, and that's when the leaders of the organization started talking to them and realizing that they really needed not only training and safety, but also knowing their labor rights, knowing that even though they probably didn't have immigration status, they needed to know what they were doing in those construction sites, but also what were their rights. Those were the times before Sandy storm that hit it in October of 2012 in New York City, that it wasn't very known that these men were working in the shadows. In the shadows, we were talking about a situation of a lot of informality back then. But it wasn't until Sandy storm hit it in New York City that this population became into the lights. Why? Because that was the moment when They were the first respondents to go out into the places that needed workers to clean the basements, to clean the areas that were affected by the storm of Sandy. So that's the reason why in 2012 we put it there. For us, a very important moment of our history, because the members of NICE, that was a very small population back then, maybe around 300, 400, really came out of the shadows to go and do these jobs. And that was also the precise moment where us organizations, the same organizations that Akran mentioned, among them the organizations that later became worker centers, we started talking about what are our rights and why aren't we organized to provide those rights to our worker members, to our community members, and especially the trainings that we need in Spanish, in our language, culturally responsible, culturally dignified, for free, that we can provide for them to be protected and to basically survive in case of any accident doing their jobs. So NICE became one of the most important organizations protecting and defending day laborers during those years after the Sandy storm. And that's how in those 5-6 years later, NICE became a very important worker center along with other organizations. We become one of the most important coalition in New York City. And during all these years, we achieved a lot of victories, obtaining the recognition of not only the right to get those certifications for free for our community members. We're talking about obtaining a budget, a specific budget from the city to provide certifications and licenses for our community members every year. And I just want you to understand that, of course, we're talking about a community that is going to provide work as an informal an informal economy, but to obtain a license that is saving their lives, a license that is also recognized by the city and by companies, a formal license, right, that is recognized as a license that is necessary to be able to provide, to do their work, right. Well, obviously, we also led many other campaigns and advocacy to continue protecting our workers, because that was not the only license that we needed. And in construction, we led many other things, considering that construction is one of the most dangerous industries in the world, and in New York City even more. But obviously we face in the beginning of 2020, as Akran mentioned already, COVID-19, being Jackson Heights, Elmhurst, the epicenter of the pandemic, it was a devastating time for us. We had to go in total emergency mode. The first day that the emergency wasn't even announced, the pandemic wasn't even announced, I remember really well, I was already at NICE on March 13, 2020. NICE was already doing their plan to close, but to become an emergency center and to provide everything that we could for our community members, because we knew that our population was going to be one of the most affected. As we knew, we started seeing our community members impacted the most. A lot of our community members were dying. We didn't have enough resources for them. Hospitals were absolutely, devastated. Our community members were calling us. We were trying to provide them with resources in terms of health information, food, eventually cash allocation, everything that you can imagine. And we did that work. We became NICE staff. We became essential workers. We had hundreds and hundreds of community members becoming volunteers. It was a very tough time for us, but eventually we became a relief center, and it was a very important period for our community members because we were able to support thousands of people, but obviously it was also a very dark time for us. But I'm happy to say that it was also a period of hope. But at the same time, and I guess that was also the time that, particularly for me, the transition from being director of training to become the executive director, for me was a time to reflect what was next after this period of economic devastation for our community members, after so much death and so much you know devastation. What is next for our community members? And you got to remember that starting in 2022, and maybe some of you do not have this context, and I'm happy to share, we started seeing a new wave of new migrants coming to the US and coming to New York City, because of a political game in the country. And so it's starting at the end of 2021 and 2022, waves and waves of new asylum seekers coming to the city, for thousands. So that became a huge challenge for the city, and especially for NICE, because Queens, as I said, is a very beautiful enclave of migrants. And so the question for us was, how can we evolve as a community-based organization that has always been there for our community of immigrants, especially for day laborers, but now is facing the fact that we have not only this community of migrants that is aging, that has been for a long time working in the informal economy, and now is welcoming this new wave of migrants that has a very different demographic profile. And let me just say this. We were welcoming a lot of people from South America and a lot of people from Africa, a lot of people from other places that was bringing very different credentials, that was bringing, I'm not gonna lie to you, masters, PhDs, entrepreneurs who have a very different experience and who obviously probably needed to, who will have another opportunity in terms of legal status, because most of our people obviously was undocumented. So when I started as executive director, I was facing the challenge, the very, very, very difficult challenge, to come with a vision, to present a vision and on how we're going to address the situation of having a very, very heterogeneous population and very different challenges in a very different time in our life as an organization. So for us in 2023, 2024, we were facing a very transformative moment. And so for that reason, it took us a few years to come up, well, I'm not going to say a few years, just a year or a year and a half, to do an assessment of everything that we have done in the last years, to come up with a new framework, a new way to really address all the challenges that was affecting our community members, and how can we provide the same, more dignity, more safety, more solutions to our community members, so different between them, but at the same time facing the same challenges and facing the same dream. I want to be here, and I'm going to go to what Akran was facing. Us at NICE, we actually focus on the arrival and integration phase. And from what we have seen, this is what our community member want. We want to be here, and we want to evidently not only survive but thrive, but also dream about what is come next, what comes next for our kids, for our children who need to go to school, what comes next when I need to leave the shelter that is provided by the city, I need a housing situation, I need to start working the next day that I arrive to the city, I need to be protected when I go to work to a gig, and eventually I need to stop working in a gig, I need to have a stable job. I need to eventually potentially get an immigration status that is stable? How can I do that? So all these questions were like, dancing around us in the moment that we needed to really come up with a framework that was sustainable for us to be able to cater all the people that were coming to NICE. Just to give you another piece of context, at the beginning of 2024, we were catering around 1,000 people per month, which is crazy for a CBO that is around 25-30 people in the staff. If you go to how do we do it, Akran, next. How do we do it? Yes, thank you. So this is what we do. And it also kind of mirrors a little bit what you were saying, Akran. What we do at NICE is we provide a comprehensive workforce development and life skills development program that we call a pre-apprenticeship for life and work program that is that caters long-time New Yorkers, immigrant New Yorkers, and new New Yorkers, specifically people who have just arrived, and it's who aims to evidently box the old broken system and embrace a modern and innovative pre-apprenticeship model for immigrant workers where they can build on their experience and empower participants through continuous professional skills leadership. What does that mean? We want them to use the knowledge and the credentials that they bring from their past. We want them to also use the tacit knowledge that they bring, meaning what they learn through work that is not recognized through academia, because there is obviously richness in that, and to provide them the life skills, the soft skills, and the very, very critical skills they need to thrive in this economy in the US. And I think that you mentioned many of these elements, Akran, when you talk about all these determinants, the social determinants. First of all, we need to recognize that to thrive in the US, you need to have the language, you need to use technology, because labor has moved to another frontier, right? So ESL, technology, English as a second language, technology, digital literacy is something that we need to provide. Industry learning, it's another element that we haven't stopped providing, as you know, because Akran, I met you providing components of our OSHA SST training. This is how I met you, because I remember you very well, and we haven't stopped providing our professional licenses and our industry learning credentials, and we are just incrementing the capacity that we have. For us, even though we recognize that many of our community members will end up in informal economy, we believe that they deserve better. We believe that no matter what, they need to be prepared, and we are going to send people to work with the right skills and with the right knowledge. That means that they need to be prepared with including the soft skills, because if we do not provide, that's going to be on our reputation, NICE, as the organization that is sending job seekers to the right job. So ESL, technology, industry learning, professional licenses are like part of our workforce development program. We also have legal services for the participants of our pre-apprenticeship, because there's a connection between legal and labor. Many of our community members, mostly the people who have arrived in the last 3 years, are able to be eligible for an immigration an immigration benefit. Obviously, the situation has changed with the new administration, but this is something that we are talking with our attorneys, with our paralegals. We are being very careful about it, because we understand that it's a complicated situation, and the decision it's in the hands of each one of our members. We are also providing what we call our life empowerment critical skills. What does that mean? As an immigrant, you need to navigate multiple systems when you get to New York City. I think that anybody that has come to this city, but it's the same if you go to Mexico City or to Bombay or to Lima or to any place in the world. If when you get to a city, you don't know anything about the subway, you don't know anything about the housing system, you don't know anything about the health system, you don't know anything about the education, and literally, I'm just gonna use the subway system. You get lost in the subway. I have been so many times in the subway helping an immigrant and helping them to understand what is uptown, what is downtown, and to explain them how to get to Brooklyn or how to get to the Bronx. And literally, because they need to go see their attorney, they need to go see their doctors for their kids, and this is something that represent roadblocks in their integration, seriously. And so if you allow them to eliminate those roadblocks and you multiply this, that can have a very positive effect in their integration in general. So we address those challenges at the same time. Same for example, financial system. Nowadays, let's say you get a gig shoveling snow during the winter. Nowadays, nobody has cash. Nobody's going to pay you with dollars. Nowadays, everybody's going to use Venmo, Zelle, and all those digital ways to pay you. So, for that, you need to have first and foremost a bank account. And for that, you need to have an ID. And for that, you need to go to the DMV, the Department of Motors and Vehicles here in New York City, to get your ID from the state, or you need to do the same with the city. And for that, you need to have your passport, etc. There's a chain to do that. So that's what we call the life empowerment, the critical life skills, the part of the systems you need to navigate. So again, we provide the workshops, and we provide as well, we help them to make that appointment, and we nudge them. So we use behavioral change to go and do that. So we don't do that for them. We do this with them, and we make sure that they do it, because as one of my mentors told me many years ago, I'm gonna say in Spanish, enséñales a pescar, no pesques por ellos. Teach them how to fish, don't fish for them. I don't know if that's a translation in English, but that's what we do through empowerment. And we do this all at the same time in a period of 5 weeks. We do it through cohorts of 25 people, sorry, in 5 weeks. And we do have those life empowerment skills: housing, financial, health. I already mentioned the other one, I forgot, transportation, and there's another one that I forgot, I'm sorry. And in addition of what we call empowering leaders, which is culture, the do and don'ts in this society, and the soft skills. And when I said the do and don'ts, to be completely honest, is the same as everywhere. Like, yes, okay, they're telling me that I need to end. All right. So, and just to finish, the facilitated entry is that we prepare our job seekers in to prepare their resumes and to be prepared for interviews, and it's part of the soft skills. What do you do for an interview? And we know, as a migrants, as you mentioned, Akran, in the journey, you go through a lot of trauma. We are talking about people who have crossed 3 continents, who have crossed 7 countries, who have crossed a jungle. We have seen this because we have done mock interviews. We do mock interviews with real corporates. They come and they tell you their stories. So that's the reason we actually do this with real corporates, so we can train them to do interviews. This is we're talking probably about informal economy, but we are also making sure that people do well, and we have seen very positive results. We have people who have find jobs in JFK. I'm just giving you examples. We have seen very positive outcomes from our pre-apprenticeship now. Just in conclusion, because Akran is giving me 1 minute, we really believe that we need to change the models to be able to push also the frontier of informal, formal economy. That's it.
Thank you so much, Nivea. That was great. I can attest to everything she's saying. I mean, her organization is incredible. And I remember when we met, we went to the worker center and there were like maybe 20, 25 workers there waiting to get a job that day. They didn't even know where they were going. And I would stand there. They would give me the opportunity to stand there and talk about health and safety in the workplace. And then all of a sudden I had to stop the training because somebody got called. Hey, so-and-so, you got a gig in somewhere. So they would get up from the training and go, and I would stop because that was the priority. So we were training, and it was just one of the many things that we've done together just to support, all the workers. So thank you, Nilvia. I'm gonna stop now. I'm gonna hand it to Clive. I think there's gonna be a Q&A. Clive, you want to handle the Q&A, or you want me to do it?
Akran, it's all you. Go ahead. You
Sorry?
go ahead.
Okay. Si alguien quiere preguntar en español, bienvenido sea. Los dos hablamos español, perfecto, también. So if you want to write your questions in the chat, so we have around 5 minutes.
There are some questions already there, Akran.
The Q&A, I'm so sorry. Yeah. Okay, all right. So, el esquema sobre prevención, el esquema sobre prevention to design es muy interesante. Me lleva a pensar que gran parte del trabajo que se hace en Latinoamérica seguimos trabajando en los 3 primeros niveles y más con los trabajadores informales. ¿Qué necesitamos para ir más allá en los últimos niveles? Elvia Luz González Muñoz. So she's mentioning about the prevention through design and that we're in Latin America doing a lot of the last steps and what do we need to do to go to the first steps. Acra, no alcancé a anotar el nombre de la segunda población que mostraste. Okay. Bueno, I'm gonna answer in English. I think elimination and substitution are probably the ultimate goal because you're doing primary prevention. The further you go down the pyramid, you're going through secondary and tertiary prevention, ¿verdad? So, la idea es hacer prevención primaria, que es la parte más arriba de la pirámide, que es sustitución y eliminación. Estás haciendo prevención primaria. The further you go down is you go secondary and tertiary. A veces no se puede, sometimes you can't, but I guess you have to study the risk factors and you have to study the exposures first and to see how can you accomplish the minimizing at its max the risk factors. ¿Cómo podemos llegar a minimizar el máximo los factores de riesgo? That's really the whole point of this, of the primary care through prevention. Ningún trabajo es cero riesgo. No work is zero risk. And our work is to minimize the risk at maximum. So nuestro trabajo es minimizarlo al máximo. Okay. Dr. Sanjita Das. Thank you, Akron, for this wonderful, insightful presentation. You have mentioned your clinic's outreach program. Are there any community health programs in New York City specially designed to address psychosocial needs in migrant workers? And if so, these programs are being implemented? Okay, so that question is for both of us, Nilvia. And thank you, Nilvia, for this informative presentation. Could you please highlight, according to NICE, the field experience of most prevalent health safety among these workers? So you want to start first, Nilvia? She's saying, can you highlight, according to NICE field experience, what are the most prevalent health and safety concern among your members?
Thank you for the question. I would say that workplace injuries and hazard, yes, of course, like many workers, especially in construction, cleaning, restaurant industries, they face risk as falls, exposure to chemicals, repetitive strain injuries, often because there's no proper training and safety. There's no proper safety training, no equipment. that kind of situation. There's also obviously lack of access to healthcare, mental health stressors, exposure during crisis, and obviously, I don't know if this is considered health and safety. Well, it is. Wage theft and overwork, and all the violations of labor rights.
Yeah, and I want to build on that because so the question about psychosocial risk factors is they're all embedded in what Nilvia just said. Because the whole 4D theory that I mentioned earlier, all the social determinants of health, we as best as we can, and we have established workers' compensation cases where psychosocial risk factors have been part of them. We can expand more on a one-to-one conversation. So it's 1:30. I want to thank everybody at respect of time. Clive, you wanna close?
Yes, thank you, Akran. I just want to thank both of our presenters, Akran Salman Navarro and Nilvia Coyote, for your wonderful presentation. I'm sure we wish we had more time to discuss some of the nuances of how they both collaborate to their respective organizations. But I hope this webinar was helpful to at least give some understanding of the context and the complexities of informal work in New York City. Once again, our website's here. Our technical committee meets the third Friday of every month. If the topic today, and if these kinds of topics interest you at the intersection of ergonomics and informal work, please reach out to us by email, and we'd be glad to have you join our group. With that, thank you, Akran, Nilvia, and thank you, Andrew Thatcher, for providing the technical support. And we look forward to seeing all of you at a future webinar. Thank you all. Bye.
Thank you so
Bye.
much.
Thank you for having us.
Thank you for having us.
Bye, Andrew. Thank you.
Thanks everyone for lovely, informative talks. Thank you.